Top health stories last week: ban drugs on sale, more women demand CS. Top health stories last week: ban drugs on sale, more women demand CS. Nigerian Senate investigates 42 banned anti-malaria drugs. The Nigerian Senate said it would investigate reports of 42 anti-malaria drugs banned by the European Union (EU), but which are still in circulation in the country. The EU reportedly banned these drugs as a result of their effect on health, including causing kidney failure. One of the banned drugs is artesunate, which is widely used in Nigerian households. Women increasingly demand cesarean section. The cesarean section (CS) option in child delivery is becoming popular among Nigerian women, a survey reveals. The survey across some southwest states and Kwara indicates that the increasing popularity of the procedure was hinged on factors ranging from medical reasons to social considerations as well as unethical motive to make profit. Ijartimi Motate, a senior lecturer in the Department of Obstetrics, Gynecology and Perinatology, Obafemi Awolowo University Teaching Hospital, eLife, said CS could be justified whenever it was deemed that the life of the mother or fetus could be in jeopardy if vaginal delivery was allowed. However, the CS rate was on the increase worldwide and remains a cause for concern considering the risks associated with the procedure. Scientists release 20 million mosquitoes. Scientists in California are releasing 20 million mosquitoes in an effort to shrink the population of mosquitoes that can carry diseases. Millions of sterile male mosquitoes will be released, which will then mate with wild female mosquitoes. The eggs the females lay won't hatch, researchers say. The project is called Debug Fresno and is being undertaken by Verily, a subsidiary of Alphabet, Google's holding company. The goal is to cut the population of Aedes aegypti mosquitoes, the species responsible for spreading Zika, dengue and chikungunya. Aegypti, which have been present in California's Central Valley since 2013 and have been a problem in Fresno County. Japan renovates PHC in Abuja. The Japanese government has handed over a 15-bed capacity clinic, fully equipped with solar-powered panels, to Shire Community and Bwari Area Council, FCT, to strengthen healthcare system in the community. Sadinabu Kuzoke, ambassador of Japan to Nigeria while inaugurating the facility, said the project was designed to provide appropriate and reliable healthcare services to the community. He said the primary healthcare facility, which is the only one in the community, was in a deplorable condition with just a nurse, in spite the large population of the community. Enugu employs 291 health workers. The Enugu state government engaged the services of 291 health workers to monitor and minimize patterns of spread of diseases in all the political wards in the state. The Director of Public Health Services, Akshukwu Wasai, said the workers would also report incidences of disease outbreaks to 88 focal sites for disease surveillance in the state. He explained that the government extended its network on disease surveillance to check the practice of self-medication and unconventional treatments for diseases that could be a threat to others and communities. Artist stages exhibition to raise awareness on hepatitis B. Photos from art exhibition to raise awareness on hepatitis B. An art exhibition to raise awareness about hepatitis B and raise funds for vaccines for people in Jeremy IDP camp for World Hepatitis Day on July 28 was held in Abuja. We are convinced that we can positively use art to sensitize people to social issues, said Tola Ajaya, the organizer, contributing artist to the exhibit, and founder of May Palette organization which hosted the event. Hepatitis B is a virus which inflames the liver, and is said to be more deadly and more common than HIV. Like HIV, hepatitis B yet has no cure. The virus spreads through simple contact with bodily fluids, such as sweat, semen, blood etc. of an infected person. Make diarrhea drugs available in public hospitals. Nigerian state governments have been urged to make zinc and low osmolarity, low ORS, drugs available in public health facilities in Nigeria. Zinc tablets and ORS are drugs used for the treatment of diarrhea in infants and children. In 2012, diarrhea was one of the top 3 killers of children under the age of 5 years in Nigeria, causing approximately 100,000 deaths. The World Health Organization recommended the use of low ORS to treat the disease in infants and under 5 children. Cholera death toll rises in Kwara patients in hospital ward. File photo: 17 persons have been confirmed dead in 1,617 reported suspected cases as cholera outbreak continues to ravage Kwara state in north-central Nigeria. The Nigeria Center for Disease Control, NCDC, disclosed in its weekly epidemiological report for week 26 that the suspected cases were reported as at the end July 9 with 13 laboratory samples confirming the disease and a case fatality rate of 1.1% recorded. This is an increase of 3.6% suspected cases from the previous week's epidemiological report where 558 suspected cases were reported, 13 confirmed and 11 deaths recorded. Children under the age of 5 remain the most affected with 460, 28.4%, of the cases reported, with the male population accounting for 51.6% of the cases. WHO warns of HIV drug resistance. HIV ribbon. The World Health Organization, WHO, has warned that the spread of an HIV strain resistant to some of the most widely used medicines could undermine global progress in treating and preventing HIV infection if early and effective action is not taken. The Director General of WHO, Tedros Ghebreyesus, stated this in the WHO HIV Drug Resistance Report 2017. According to him, in 6 of the 11 countries surveyed in Africa, Asia and Latin America, more than 10% of people starting antiretroviral therapy had a strain that was resistant to some of the most widely used medicines.